My name is Josh Renkens, and I'm a doctor of chiropractic. I'm co-owner of Resilient Health and Performance. We see primarily repetitive strain injuries. We see both acute and chronic. We see everything from post-operative to people that get injured while training or in athletic endeavors. We implement a lot of different techniques. As I said, with chiropractic, we do some traditional work there, but then our specialty really lies in more soft tissue based stuff where we treat muscle, fascia, ligament, tendon, nerve entrapment disorders, and we implement functional release technique, active release technique. We do dry needling, we do some various taping techniques, and then we always prescribe corrective or rehabilitative type exercises to further facilitate the resolution of various injuries. One of the techniques that we use here when appropriate is we use what's called dry needling. They use traditional acupuncture needles, and we use it to treat a variety of different conditions from tendinous issues to spinal issues. And here, this gentleman's got some tonicity, some tightness throughout his lower back here. So what I'm going to do is I'm going to insert a couple needles into his back to sort of reset the tone of that musculature. It's not really painful, it's just a different type of sensation that they might not be accustomed to feeling. The needles come in various lengths, so depending upon what part of the body we go into is sort of how long of a needle we use. Here in the low back, I'm using a 50 millimeter needle, and you can see that they're not going all the way in. And now here what I'm going to do is I want to actually hook some electric stim through the needles to get the muscles to twitch. And that's the goal, is to elicit the local twitch response from the muscles. And there you can see the needles moving with the contraction and relaxation of the muscles of his lower back. The most frequency I would do it would be once every 5 days. I typically recommend, if we're going to go through a session or two or perhaps even 3 of the dry needling, that we do another subsequent session anywhere between 5 and 12 days from the prior one. It seems to work best. The needle could stay in there as little as 10 seconds, or it could be in, typically no longer than about 3 minutes. That's it.
Very cool.
Sit up so we know you're live on camera.
Yeah.
Thumbs up.